hello, hello, hello. Good night, everyone. Good night, everyone. So happy that you could join me. This is Home Care TV, and I am your host, Muriel Melville. Tonight's topic will deal with how to handle behavioral changes in our clients, how to deal with behavioral changes in our clients. And this issue is very common. People moods change depending on what they're going through. So we're going to look into that tonight. But before we get started, I must thank you for your support. For those who are joining for the first time, welcome. Also, welcome to those of my continued supporters. I would like to ask you to continue to share, like, and subscribe. My new viewers, I'm asking you to do the same thing also. Share, share, share. Like, subscribe, tell a friend. If there's someone you haven't told about Home Care Queen TV, I'm hoping by now you're enjoying my episodes. Don't keep it to yourself, share it out. Okay, so let's go into our topic. Let's go into our topic. So, we're dealing with behavioral changes. And behavioral changes can be anything that disrupts the normal function, anything that disrupts the normal function of your care or your work with the client. So, how do we deal with that? How do we deal with that? I am going to give you some of what I've used and some experiences or examples of how I've dealt with these behavior over my years of working, and also what could be seen as a standard way of dealing with clients that can be challenging. Now, every facility, every agency has their protocol, and their employees should have knowledge of how to use their protocol. So, I'm going to be addressing or putting more emphasis on the private caregiver, the person who's working for themselves, and some of the tools that I've used and could mirror some of the tools that are used in facilities. So, you are at work, things are going well, and then it's time for breakfast. Mary or John, you introduce breakfast to them. They push the plate away. At first, you thought, okay, maybe I didn't set it right. So you set it back again and encourage them to eat, and they push it away. And then they become what seem to be agitated. And when we say agitated, yelling, pushing things, not wanting to sit down, what do you do? The first thing would be to keep calm. While they're going up, you can't go up there with them and say, it's breakfast time, you need to eat. No. Remember our former First Lady says, when they go high, you go low. It works. So you're going to try your best and keep calm. Do not introduce the breakfast back to the individual. Remove it from the table. And then if it's possible, if the person can communicate with you, you ask them what seemed to be the problem. Are you in pain? And then you start further assessing. Are you in pain? Are you feeling any burning? Now, if when you got and you notice that the rain is falling a little more frequently down there, and there's some disruption going on down there, they're using their hands a lot in that area, then you start to put everything together. Okay, so there's a little more frequent raining. There's some thunder striking down there. It's time to notify your agency if you're working for an agency. If you're working in a facility, you ring that bell and you get your nurse in there. If you're working for yourself and there's a family nearby, meaning in the house, you call them and you bring their attention to it. Now, if you are working with them, which happens frequently, family members hire you, they live out of state, you should have had all the information how to contact the family, the information how to contact the doctor. You contact the family, you said, mom, dad, sister, brother is not feeling well. And after my assessment, it seemed like they're having a UTI or something like that. I would like to take him or her to the doctor because I'm not comfortable. And then you take the person to the doctor. Now, if it's a situation where no thunders are rolling down there, the rain is not falling frequently down there, then you now have to use your best judgment and try to de-escalate the situation. So you have moved the breakfast because that's an irritant. Give it to them, they're pushing it away. What I would suggest is that you leave the person at the space they are for a while. You let them know that you're safe. I'm here. I'm in the kitchen or I'm going to the bedroom, and you leave the person for a while. Give some distance between you. If you come back up the hallway and they see you and they're acting out again, I would call the family. I would call the family and notify them that, seems to be no sign of a UTI, no medication changes, but I can't seem to get her to calm down. Now, safety is first. Safety is paramount. So you call the family, you inform them that this behavior is continuing. And you are not feeling safe to take the person to the emergency room. because you're going to be locked in a car with this individual, call 911. Call 911 because you would have notified the family that this behavior change is progressing and the safety of the client and yourself is paramount. So you call the 911 and you let them come in. They will decide whether the person goes to the hospital or not. So if the ambulance persons are able to calm the person down, blood pressure is normal, everything is good, and they decide that they don't need to go to the hospital because sometimes ambulance decides that. If you still don't feel safe, I would suggest that you say to them, I'm here alone with this individual, and I would rather her go to the emergency room and be evaluated. And they will take the person. They will take the person. Now, after you have been through all that and take them to the emergency room, they're given a PRN, they're calm, they send them back home with you. On the way home, and when you get home, do not bring the incident up. But she was yelling and ripping and raving at me. I know. But bringing the incident up might create the same reaction. So you try to distract the behavior. By now, if they're discharged from the hospital, they should be pretty calm. So when you get home, and a person probably, you get home, you offer something to drink, you offer a snack, and the person goes down to take a nap. When they get up, do not say, you know where we were this morning? I had to take you to the emergency room because you were fighting. No. You try as much as possible to stay away from the incident. Stay away from referencing the incident. And what you do to turn that around, you talk about something different. And let me pause and say this. Use simple words, clear words, look the person in their eye when you speak. Would you like to go to the bathroom? It's time for your medication. You give the person space and you continue your work with them. Keeping some distance as long as you can see the person and you can reach them within seconds in case an emergency. Now, I'm not talking about a fall risk here. A fall risk, you should be very, very, very careful in creating distance after they have been medicated at the emergency room and they come home. You should keep a very, very close eye on this person. I'm talking about someone that is able to ambulate on their own with minimal assistance. You always make sure you can see the person. And you know another thing that works? Letting the individual know that you're safe. I know you're not feeling well, but you're safe. I'm here with you. It reassures them. And you continue with your task for the day. Whenever you are reapproaching or redirecting, remain calm for the first couple of hours. Don't rock the boat. Don't rock the boat. Remain as calm as you possibly can. Allow them to request what they need if they can. Can I have a glass of water? Or can I have a cup of coffee? And you said, sure, just a minute. So you see how you're maintaining a safe, calm environment. Because changes happen for different reasons, as I mentioned. Most common ones seem to be new onset of or recurring UTIs, medication changes, maybe, and believe it or not, maybe a family member called that they don't get along, and that triggered them in the first place. Also, be aware that you can also create a trigger for someone. Yes, you can. In ways that probably you're not even aware of. Whenever a patient got agitated and their mood and behavior changes, in my experience, I've always gone back to look at their H&P, history and physical, their chart. I always go back and look at their diagnosis, look at what they've been treated for, look at allergies. Allergies is not only medication. Allergies is also not always things in their home. So you could have changed your perfume or your deodorant or your body wash. Anything can trigger behavioral change. So while you're doing the assessment on the client, be aware of your own changes that happen that day. And once you understand that, you won't panic when they change their behavior, or you won't feed into the behavior. You won't feed. Remember, I talked about breakfast? If you, the goal is to make sure they're eating healthy, but you offered it once and they refuse it, and you retry and they refuse it again, there's no need for a third time. There's no need for a third time. Give it a rest. It's the same way in looking at yourself and assess, what did I change today? What did I change today? How did I, meet her today? Was this a trigger for her? So you're looking at the whole issue, not just looking at what what can cause it in them, but you're also what can cause it from you. Okay? So you've gone through all of that. The person is calm again. You're back in your regular routine. That's for the home. With an agency, call your supervisor. Get someone out here for me. In facilities, know your protocols. Know your protocols. Call for help. So in every environment that you work, you see the tools that can assist. But as you can see, that the most difficult one is the one where you're working in the home and you're alone. Now, something came to me. Something came to me. A video. A video was sent to me of a caregiver and her alleged patient, client. And it seemed from this video that they were in a private space. I'm going to allege that this individual was a private caregiver in the home, And here's a synopsis of the video. So the caregiver was preparing something in the kitchen, and the client spat at her, seemed to be in her face. Now, it's alleged that this person was dementiac. Now, I want to stress this. The behavior of the client was unacceptable. So let's get that. The behavior of the client was unacceptable. Where I'm having my issue is there was a video. When I watched the video, there was a camera on the counter. That brings a whole different scenario. So let's go through it fairly, impartially, and neutral. I'm alleging that this behavior, the client had this behavior before or other type of behavior. And I'm also alleging that probably she notified the family. Probably she notified the family and seemed that she was not supported. So she decided to record the incident so she can present it to the family. And this is my opinion on this matter, because for the life of me, I cannot comprehend any other reason why this is done. I cannot comprehend why someone would video a client unless it's a situation where they are desperately seeking support from the family and they're not getting it. So the person figured, let me video this and send to them. Now, here is my next issue with this video. I'm trying to understand. I'm trying to put myself in this individual space by saying what I referred to before. Why did it end up on social media? That's the issue I'm having. Is it right for her to have videoed it in any situation? I wasn't there. I don't know what transpired, why she had to do that. But the big question is, why was it published live? It seemed like it was live on social media. If the video was intended to draw support or urgency from the family in seeking an assessment from this individual, and the person felt they were not supported, why was it on social media? Now, let me say something. Caregivers, I would not suggest, support, encourage anyone to take a picture unless it's a celebratory occasion. Because I can remember while I was working, it would be mom's birthday or grandma's birthday. And I got a cake and family sending flowers and gifts. And they said to me, could you take a picture of it and send it to me? Those requests are made. But you know what I did? And what I would encourage? After I sent that picture to the family, I delete it. Oh, yes, it's in cloud. It's still on your phone. I'm not responsible for the fact that it remained on my phone. What I'm responsible for, I did. Caregivers. In past videos, I talked about the gray areas when you work in someone's home and how you have to be cognizant of your environment. Have you heard of this entity called HIPAA? HIPAA is the backbone of the healthcare industry. Home care is a part of that. Home care is a part of that. We are there to protect, to keep the individual safe, and to secure their dignity. We're there to secure their dignity. We're not just there just to make their beds and keep them safe. And we're also there to secure their dignity and their privacy. And I can hear the bells going off. Well, the address wasn't up there. The name wasn't up there. But guess what? The face was there. The whole human person was there. The caregiver, her humanness was on there too. Let me tell you something. I have this I have this thing that says that fearfully and wonderfully made. Pardon me. Something just went to hurry. Pardon me. I don't know what just happened. Pardon me. I hope yes, I'm still going. Pardon me. Something just happened. I have this thing that says I'm fearfully and wonderfully made and have everything by my creator. But sometimes it seemed that all I got from him was sight. Because sometimes we can behave so brain dead that we forget that we are made with all of our faculties. And as far as it goes, if we're working, they're supposed to be working too. Putting a person that is left in your care on social media, there's nothing right about that. There's nothing right about that. I get it. I said it over and over and over and over and over. Caregiving can be stressful caregiving can get overwhelmed, especially when you're there by yourself. And the gray area is that you're in the person's home. You're in the person's home. But here's a problem. When we get so comfortable that we forget where we are, these issues can arise. These issues can arise. And, social media, I'm a part of it. I'm a part of it. It's a good thing. But like anything else, when you're too preoccupied with it, you can lose insight and judgment. Because ask yourself the question, if you're ever tempted to do this, ask yourself the question, if there was no social media, how would I handle this issue? Because we had this issue. We have this issue from creation of the healthcare and home care business. We have this issue of patient behavior changing and patient becoming aggressive and somewhat mean. And we dealt with it. We dealt with it. And we dealt with it good. Creating situations where you can get barred from the home care or senior care industry is not worth it, because every certified individual out there knows that if this gets out, that I have someone in my care, and it did get out, and we don't know what transpired after that video because there was no follow-up. But just put yourself in that space. Why would you jeopardize your job? And if you're certified, why would you jeopardize getting blacklisted for views, for comments? Then you have lost your job, and the probability of getting another job in the industry is very slim. We don't know what happened to that person. But why I'm addressing this issue is that we will always have behavioral changes in our clients. But our phones is not one of the tools to use to de-escalate the behavior. And I will eager to say and to suggest that not even in the privacy of the person's home should you be videoing. You should not. It's an invasion of their privacy, an infringement on their dignity for you to have. And yes, I have heard the stories. Well, I'm like family. You're not family. You are not family. And this is when we get in trouble. When we put professionalism in a rocking chair because we're in the home, that's when we get in trouble. At no time should you forget that you're working with this person. Yes, they're nice to you. Of course, they're nice to you. They want you to come back. They want you to come back. You can show Appreciation, love, and respect. Now, love is subjective. There's agape love, love of humankind, empathy. Those are the things you're supposed to show on the job. Professionalism, respect. But the love that I hear sometimes pass when it comes on to home care, because the persons treat you well, the family comes in town and they take you out for dinner with them. Okay. If anyone knows me, they know I can be blunt. Let me say this. When a family takes you out for dinner with the person you're caring for, one is to socialize with their family. That's the most important thing. Two is to allow them to enjoy themselves while they're out. You being there, you're still someone that's taking care of mom. So if the family member gets a call and they have to dip out of the restaurant, you are there. You are there. And offering you a meal, I've said it to several caregivers. When you go out with a family and they offer you to participate in eating with them, for the sake of Moses, Isaac, and Jacob, do not order a lobster and steak and shrimp and a glass of wine. Don't do it. Offer the menu that is the most economic, efficient menu. Really? But they take me out. I've been working with them for years. Yes, you have. Remember? Working. Now, let me tell you a story that someone shared with me a few years ago. This family member came in town and they took their caregiver with them to a restaurant and they ordered across the board. They ordered, Mom, would you like to try this? Mom, I'm going to order steak. And the other family member, Mom, I'm going to order lobster. And Mom, you order shrimp and we'll share. You know what the person told me the caregiver did? She went ahead and ordered steak and all the trimmings that came with the steak. This individual was working for an agency. And as the family member got the opportunity to call the agency, they did. They reported the individual. They said, we went out for dinner with mom and we took Jane with us. And her bill came up to $54. We can't have her back with us. Do you understand what I'm saying? Do you understand what I'm saying? Whenever you're with your client, you're always working. It doesn't matter where they take you. They take you there, as I said, to continue the care. They take you there to continue the care. How does this fit in behavioral changes? knowing our environment, remaining professional at all times, knowing your boundaries. I said it before. Knowing your boundaries. Why things happen most of the time is because we get too comfortable. We get too comfortable. Now, during this video, as I watched and did my own assessment, I must say the caregiver remained calm. That's why I alluded to the fact that she must have reached out for help and did not get the support she needed, so she thought to video. But my issue is, why did it end up on social media? So yes, the explanation about going out for dinner is a part of it, because when we put our professionalism in the rocking chair in the corner when we're in the home, that's when we wind up with problems. Now, don't get me wrong. I want you to hear me. There is nothing wrong in showing kindness. But do not get so attached that you lose focus. What are you talking about, Muriel? I've worked with them for 4 years. I love to use examples. It's just who I am. Do you have a family doctor? How many years have you been with your family doctor? For me, mine is a few years well. And every time I go to see her, in her body language, I can see that she is so happy to see me and to deal with my issues with me. And when we're finished with our visit, she has never hugged me. She has never hugged me. Here's what she does. She'll look me straight in the eye and say, I'm so glad you're improving. I'm so happy your medication or whatever you're using is helping. I can see it in your blood levels. I can see it in your numbers. Things are looking up. Don't you think she doesn't care about her client or patient? Yes, she cares about me. She cares about me. Here's what she said: to acknowledge me. I am so happy your numbers are going in the right direction. That's acknowledgement. And because we're in the home, knowing these things will assist us in feeling good about ourselves. I'm doing a good job. Know that you're doing a good job. Know that you're doing a good job, because the moment something goes wrong, they will tell you. They will tell you. Family agency facilities, they will tell you, either to the extreme, or they will sit you down and revisit. You either get fired or you get counseled. So, if those things are not happening in your life all the time, be confident that you're doing something right. And I said it in a previous video. Caregiving. Caregiving is not for everyone. It's not, because it pulls your emotion. It pulls you. And if you don't know how to step back, and how to reorient yourself, you get caught up. You either get caught up in feeling burnt out, underappreciated, which I'm hearing that a lot from. I feel so underappreciated by my clients' family. They never let me feel appreciated. Well, let me tell you, they do. By the example I said before, the fact that they are not, pardon me, the fact that they're not calling you and saying, Mom told me you did this, and Mom told me you did that, and I'll be down this weekend to sit and have a talk with you. You're doing good. You're doing good. Caregiving is not an instant gratification job. And you're going to hear me say that a lot. It is not. So you have to take that out of it and know that if the family is not complaining, they're pleased. And that should be enough reassurance for you. Get your praises outside. Get them outside. Get your love and your affection outside, because the love and affection that is needed to be a good, effective, caring caregiver is a love that is a generalized respect and care for your clients, a generalized empathy for when they're going through their changes. But they're not your family. I don't know how else to say this. They're not your family. I don't know how much of us has perfect family that we all get along. I don't know how much of us. I have a 92-year-old dad. And let me tell you something. You can poll all my siblings and they'll tell you there are times when we say a long prayer to cope. Can you imagine if I carried that emotion? Oh, my client is my family. Then when their behavior changed, and when they started to get antsy with me, I'm going to bring that emotion over because they're family. Am I being clear? Because here's why I'm doing this. And I'm doing it because you're needed. And these little nuggets that I've picked up along the way, I'm sharing it with you. Do not put your professionalism in the rocking chair in your client's home. Take it with you. No, don't get me wrong. I'm not saying to become so professional that you're cold, because some professionals can be so cold and so dismissive. That's not what I'm saying. And you know that's not what I'm saying. But never, ever take that cap off. Loosen it a little bit. Make it be so comfortable that it's not squeezing you. And you will become the best person for your patient/client. Remember, there are doors that you don't want to open. And social media in the home is unacceptable. Get your view somewhere else. Get your view somewhere else. Now, families out there need you. And the more you are aware of your weaknesses and your little stuff that you're dealing with, it's the better you are for a person. It does not mean that you don't get upset and you don't get frustrated. All it means is that you take such a deep breath that sometimes it's like you can pull the client in. You just take a whoosah moment when these behavioral things happen and take your professionalism off the couch and out of the rocking chair and continue to do the job that you love. Please continue to support me. I appreciate you. I need you to know that. I appreciate your likes. I appreciate you watching my videos. And I appreciate you sharing them. Continue to do so. This has been Home Care Queen TV. And I am your proud host, Muriel. Have a good night, evening, day, whenever you're watching this. Thanks for supporting me.